Today, we are talking about use of the legislative process to address a strong driver of health disparities in the U.S., smoking. In April of 2017, then San Francisco City Supervisor Malia Cohen proposed an ordinance that would restrict the sale of all flavored tobacco products, including menthol, within the city of San Francisco. An enormous backlash ensued, driven by well-financed and industry-backed efforts to frame the proposed ordinance as racist. In this discussion, we seek to understand how data drove this policy process, how attempts to frame the legislation as racist were countered, and how San Francisco ultimately implemented the strongest law in the country limiting the sale of flavored and menthol tobacco products. So first, the Honorable Malia M. Cohen, the 2nd District Member of California State Board of Equalization. Robert Hyatt, Associate Director for Population Science of the UCSF Comprehensive Cancer Center. We have San Francisco Police Chief William Scott. Next on the panel are UCSF researcher Valerie Yerger, who's professor in health policy in the Department of Social and Behavioral Sciences at the School of Nursing at UCSF.
So one of the first projects at UC San Francisco that I worked on was a deep dive in the thousands of pages of these previously secret but now publicly available tobacco documents. Our research revealed why the tobacco industry maintains a pervasive presence in the Black community. Not only did tobacco companies want to keep Black people smoking, but we were also able to disclose that tobacco companies used financial incentives and exchanged political favors to diffuse tobacco control efforts stemming from within Black communities and to use some Black leaders as front groups on behalf of industry interests. The tobacco industry knew that the sales of non-menthol cigarettes were declining as more educated and affluent population groups were no longer smoking at the same rates. The menthol cigarette market represented a sustained growth and profit for the industry. During the 1960s through the late 1990s, the tobacco companies aggressively competed against one another to gain a larger share of the menthol cigarette market and did so in low-income Black communities. It should also be noted that in these very same neighborhoods, there are more advertisements, more lucrative promotions, and cheaper menthol cigarettes. Today, we see an outrageously disproportionate use of menthol-flavored cigarettes, little cigars, and cigarillos among African-American adults and adolescents compared to other groups. 85% among Black adult smokers and 94% among Black adolescents who smoke. These striking statistics arise from the predatory marketing of these products in predominantly low-income Black neighborhoods. So in essence, menthol cigarettes have served as the tobacco industry's key point of entry into the Black community and helped foster the disproportionate rates of cardiovascular diseases, lung cancer, and other tobacco-related diseases and death among African Americans. And this is why menthol is a social injustice.
The data says you spend an exorbitant amount of money. I think it's 10 times more in the African American community than any other community, targeting vulnerable populations. And also keeping in mind that this was at the time right after Eric Gardner was killed by police officers. For what? For selling single menthol cigarettes. So the industry was very shrewd in how they framed the issue. But I think we were even more thoughtful on our approach. And obviously we were victorious, but the victory is still being fought. But one thing I think that is important to note is unique is that we had from very early on partnership from law enforcement. And Chief Scott signed on immediately to join forces, and he stood with us when we made this announcement of the legislation. He stood with us on the steps of City Hall, and at the time, the industry was trying to say that we restricting the sale of flavored tobacco would then increase crime.
Well, one thing I think that was really important is to get out accurate information. When people rely on tactics that impose fear and emotion, it's really important to let the public hear truthful and factual information, and then they can make their own decisions. And when a narrative is being spun up, I would say, to suggest something other than what the intent of this legislation was, and particularly from a policing standpoint, we were never intending to go out and arrest people for selling single cigarettes or go after African American boys or men because they were in possession of tobacco, buying flavored tobacco. That was never the purpose. The purpose was really to have public policy to not have those things available in our city.
And what brought me to the table was my love for my grandmother and the pain it was to watch her struggle for breath towards the last days of her life, to see her wheeling an oxygen tank to the front porch so she could stand outside and smoke her cigarette. And my grandmother had a tremendous effect on my life, but these are the last images that I do have of her. And that is what brings me to this work.
Like Supervisor Coe, and I grew up seeing most adult members of my family smoking menthol cigarettes, and people very, very dear to me ended up losing their lives as a result. My aunt, my very dear aunt, probably the closest aunt that I had, died of lung cancer. My mom died from a respiratory-related disease from smoking, from a lifetime of smoking menthol cigarettes. Growing up, I had a lot of friends that started smoking at an early age. I can't think of one who did not get hooked on menthol cigarettes. So for me, it was personal as well. We can't conflate the issues. The bottom line is this public policy will save lives, and it will save the lives of many African American people who won't get addicted to menthol cigarettes because they're not available to them, at least in San Francisco anyway. They will save lives. And maybe if this law was around back in my mom's day, she'd still be alive today.
No one individual, no one researcher or expert or community advocate in any domain will be enough to help members of our society live a quality life we all deserve. So that's why you need a team. You need your academic colleagues and you need your community experts. And we have to look beyond tobacco control in order to identify and collaborate with our non-traditional partners. In San Francisco, we had a very strong leadership reflected from members of the African American community. But in San Francisco, the population's only like about 5 or 6% Black. So it was very important for us to identify and work with those organizations that were connected to other groups that are disproportionately smoking menthol cigarettes.
What we saw from the data was that the African American population was suffering more than other subpopulations in the city from mortality from this disease. And we wanted to do something about it. And so we talked with the Tobacco Research Group, including Dr. Yerger and her colleagues, and decided that the work that they were doing on menthol and later flavored tobacco products was perfect for what we were thinking about. How do you take evidence, scientific evidence, and turn it into something that can be applied to legislation and policy and have an impact on population health?
Being armed with evidence from the tobacco documents and already compelled to reduce tobacco-related disparities, there was a group of Black tobacco control advocates in California who came together in 2008 and formed the African American Tobacco Control Leadership Council. And so for over a decade, from coast to coast and many places in between, the AATCLC had been intimately involved in just about every flavor ban policy implemented across the country. We put together a SF Can menthol task force, and we did that in 2016. And we actually put together a 3-year proposal where we really were just going to explore if there was a possibility of getting a flavor ban in San Francisco. And there are a lot of pieces that have to go into that. And you don't just say, we're going to do a flavor ban. There has to be an alignment of so many different pieces. So we needed to start a champion who was in a position to create some legislation around this. There was a young lady who worked in the office of then Supervisor Cohen, who got us an appointment. I mean, right away we got in and we met with Supervisor Cohen. She did not send one of her staff to meet with us. And after presenting what our wish was to prohibit the sale of menthol cigarettes, she asked some very good questions. And then she said, well, you know, we successfully passed the sugar beverage tax last year. We've been inoculated against big industry. Let's do a citywide ban.
You know, I had an opportunity to be presented with the data. And so for me as a policymaker, I always move in the direction to sponsor, support a policy that has a data component behind it. That is how policy should be driven. So I rolled up my sleeves and I said, let's get to work. We could pass this. And what I didn't know that I know today is that not only were we setting an example for the entire country, but for the world. As a result of what we did collectively, we have changed policy in several different countries. And I think that is absolutely remarkable. My hat goes off to the researchers that started this and really took this a step beyond the labs and presenting within their own scientific community. And this is a perfect example of how policy and data coming together and really marrying a good cause and bringing it to the public and having a positive impact on the greatest number of people.
What you've just heard is the power of science mixed with personal experience in making change. It's complicated, it's messy, it's hard, but it's still the right thing to do. So if science is going to help society, it has to be something that gets out there. This example that we're talking about today really is a perfect model for how you take science, you work with other sectors in society to make change, and you don't stay in your lane. I think what you're talking about is the feeling of younger scholars, maybe some listening now, that feel like they need to stay in their lane and do what they're supposed to do in their particular field. I don't believe that is the right way to go after many years of experience.
My advice to any scientist, any researcher that's listening to this discussion that it feels that angst or that uncertainty or uncomfortableness, that is usually an indicator that you're on the right path. And that instead of running away from that tension, we have to run to it and we have to embrace it and we have to push through so that we have breakthrough moments like this policy that we've created. For me, what I do is when things get difficult is I just remember who I'm working for and what I'm looking to accomplish. And in my perspective, this is a life and death issue. And we cannot be afraid. We have to be bold and we have to be fearless if we are going to be saving lives. And this is in policy work it is messy. But you guys take the research and then you pass it on to a policymaker. I know how to craft legislation and bring it to voters, but I don't know how to do the research.
I believe that what I do as a physician and as a scientist and as an epidemiologist has to be based on science, and it has to be used to educate the public and those that make decisions. And the fact that it's complicated just makes it more challenging and more I would say, interesting.
We need the science and we need the data to help shape and guide the policy discussions. We need scientists now more than ever. And I want every scientist to know that there is a space for you at this table.